Hello, I'm Abby, I'm 13.
Hi, my name is Tyson, I'm 12 years old.
Hi, I'm Oscar and I'm 15 years old.
My name is Tia, I am 12 years old.
My name is Anushka, I'm 12 years old.
My name is Tex Garstone. I'm a Bardi and Jari man from the Kimberleys. I'm currently studying psychology at UWA and I'm 22 years old.
I'm Medea, so I am 22 and I've been connected with Embrace since it originated. I was on the first reference group.
I'm Josh. I'm 18 in 2 weeks and this year I was in a pretty big car crash. At the start, the crash was, am I going to be able to finish school? Am I going to have a working arm again? Am I ever going to get rid of this back pain? I sort of just try to drown myself with things to keep my mind off it. Go play outside with my little brother, play my guitar if I want to, because if I sit down for a second and let myself get down about how I'm feeling, then it's probably just going to start a big, dropping down an endless pit. And it's not good for me, it's not good for the people around me.
I have people that I know don't like me, and so you just kind of avoid them like that. I just kind of don't look at my phone and stuff, and then it's kind of like separating you.
Most of the stress definitely comes from school, grades, pressure to do well. I always try to get outside and do something physical, get out in the fresh air. It always helps clear my head.
What I do to maintain my mental health, I like to ride my bike, like to play AFL, just chat with my friends and family. That's what makes me happy.
I am actually currently diagnosed with autism spectrum disorder and bipolar disorder type 2. I then had to actually drop out of university for a while to focus on myself and my mental health. One of the biggest things though is I've found a lot of support now compared to when I first started talking about my journey. When I first started being open about what was going on with my mental health, there was a lot of negativity. There was a lot of people who still had that idea of you should keep it to yourself. And I think the more that we do talk about it and normalise it, we're seeing that change.
People can do things like screenshot on social media, they can turn your words against you, they can frame you, they can spread anything on social media about you. I do go on social media quite a bit and sometimes mean things can be said to me. I guess it's just not on and it's not something you should really be doing, and I just don't feel very comfortable about how social media is working at the moment.
So I walk to and from school, I think as does Tia. You walk to and from school as well. So, we actually used to walk together home. It's quite nice because I think that kind of clears my head off of everything.
I personally just like to draw, do a little bit of math or read to help calm me down.
One of my major concerns in mental health is definitely suicide. I've personally lost a lot of family members to suicide who are also very close in age to me, and that's definitely had a huge impact on my life and the way I view the world. I've really focused on preserving my mental health and staying in positive mindsets. And one of the key ways that I've always done that is through sport and staying engaged in sporting communities, just hanging around them, and then also playing the sport, getting the physical benefits has really helped keep me in a positive mindset. Mental health has always been a big focus in my life. For me, that always meant staying proactive with regards to your mental health.
What mental health means to me is to make sure your friend, if your friend is sad, to just go up to them and cheer them up and to make sure that no one's left out.
I think that your mental health goes hand in hand with your physical health.
Mental health is just or maybe more important than physical health.
Without having one, you can't have the other, and you can't really have a happy, fulfilling life.
Being mentally healthy can mean that you can relax more and you feel happier in life.
You're kind of looking after your own, how you feel and how you interact with others.
How you take care of your mind, how you take care of how you think about yourself.
Mental health is a lot of strength and resilience, because mental health, at the end of the day, it can be something that brings you up and it can be something that buries you.
And this is what I always try and tell my friends and family, is that you need to stay on top of your mental health before it gets bad, rather than trying to treat it. And that way you can live a much more happy and full life.
And I think that's the key, is knowing that mental health is constantly changing. It's it's constantly adapting and it's about managing and supporting yourself.
I'm grateful for having friends, having a house, good family. Sometimes on the weekend you can just like lay on the trampoline or just lay on the grass with a picnic and just like read or listen to birds or just draw and just watch the clouds move or something.